This is an XLIF case using X-ray views for adjacent level disease. You can see a lateral X-ray. The screws and rods are placed at the level below. We're going where the wire is between the big boxes. That's where the disc space that we're going after. You can see that this is an AP view or a front-back view of the disc that's causing a problem. You can see the initial dilator placed. This is a good placement for the initial dilator. This is going to lead us into placing additional dilators and the retractor. You can see that the retractor now is in place. We have very good purchase of the retractor. The AP view shows that the shim is in place with a K-wire, and we can see that we're in the disc space. We're now sizing up the disc space, showing that we're okay in the safe zone is what I call it. We then go ahead and take the disc out. Once we take the disc out, we place a paddle shaver in place as well as a spacer in place to see how the disc looks and how it sizes up. This is the most important part of the case right here that we're showing next. We now have the trial in place and we're taking the trial out. We've already taken the disc out. You can see the significant movement of that vertebral body above coming down on top of that space once we take that trial out. That's showing the significant force that's going to allow a fusion to occur. We're going to jack that space up, and then we're going to make sure that we use the appropriate size. So right there you can tell that we're using the appropriate size for the graft. At this point in time, we size it up not only by the AP or the front back view to make sure that we have a good depth of the size of the graft that we're going to use. We also look at it from the lateral view to make sure that we have it good from anterior to posterior, that we're in the safe zone. Once we do that, we then put our peak graft in place. The peak graft has hash marks. You can see the front back view. We now have taken the disc out, and there's a hash mark in the middle of that disc, and that's showing that that's the middle part of that peak graft that's in place, the appropriate size. The lateral view shows the back part of that peak graft is in the safe zone. You can see this is a great view of a lateral picture showing the peak graft, the back hash mark, and the front hash mark of where the graft is. That's a lateral view. We'll then look at an AP view, in other words, the front back view, and then we'll see how it looks. At this time, that's the preoperative lateral view, so we can tell that there was a disc space. We've now taken it out, and now it's been removed. The disc has been taken out, the nerves have been freed. Here's the AP view preoperatively, and then here's going to be a postoperative view of the hash marks showing that the peak graft is in place. This is the case for an XLIF using